Hi, everybody. I see we're slowly coming in from the break, and welcome back. Again, this is Chris Sarlis, the director of the Health Campaign Effectiveness Program, and will be nice when we get a chance to have your cameras on to actually see who's in the room. I'm seeing some familiar looking names. I'm just going to give it a minute as everyone gets signed back in from jumping platforms. And we will go from there. And we're in the typical, hi Nana, good to see you. We're in, I think, the familiar Zoom format that we all know and love these days. So we know we've got our chat function down there. If you need to send a message, you can use that instead of trying to figure out the Q&A versus the chat. So please feel free to put any notes. Our team is monitoring it. I know we flashed our introductions early on, and so we'll take a minute, I think, as we get going. If you even want to in the chat, go ahead and feel free to introduce yourself, where you're from, which country, and also what affiliation, so we have a sense of who's in the room. We've got on our team several of us that will be both facilitating as well as presenting. Again, myself, I'm just looking at my Allison Snyder, our project manager. Allie, give a wave. Got your camera on. Ansley Harper is Ansley, give a wave. Ansley works as our admin assistant. Sarah Gilbreth, Sarah, give a wave, is our communications manager. Carol McPhillips-Tangam is a key senior consultant with us. Dr. Eva Bazant, who will be presenting in a few minutes. Leah Wyatt, our coalition manager. So our team is very happy that you are able to be with us today, and I will share with you the agenda for the day, and then we will get going. Now it says my computer battery is running low, so that's not a good sign. Apparently it's not working. So just a second, and I will show you the agenda for today. And let's see if we can get this going. All right. Oh, that's not what I wanted. Hang on. Too many slides. There we go. Hit the present instead of the slide. Okay. So our objectives for this session, Allie, give me a thumbs up if you can see the right view. Thank you. All right. The objectives for our session today was to give you an overview of the Health Campaign Effectiveness Coalition, which I did in the previous pre-recorded session. But again, if you missed that, feel free again to ask some questions in the chat. Present some lessons learned on campaign integration and collaboration. And we had 3 presentations in the earlier session from Ethiopia, Somalia, as well as Dr. Olamide sharing some of the initial findings from key informant interviews across several countries. What our focus is for this part 2 is to discuss the opportunities and considerations for cross-campaign collaboration, and also address some more of those deeper questions around where does it make sense to have more collaborative or integrated campaign delivery approaches. And we'd like to come out of our session today with input from you to help inform the COR-NTD agenda, as well as the Health Campaign Effectiveness implementation, research, and learning agenda on what you feel are key evidence gaps, and as well as priorities for research and learning. And so that's really our goal for the session today. We've got this organized. We want to get some energy going since you've been listening and probably sitting for a bit. have some rapid polls set up to get a sense of your experience and some of your input. Then we will hear from Eva on some of the early thinking that we're doing around campaign integration, as well as then we'll break out into 3 different breakout sessions for good conversation, and then come back together to share what we've all heard, as well as do some final wrap up. And so I will stop sharing right now. And I think Allie is going to be loading us up with a poll. So your first question is, we've talked again a lot about the topic of integration. So from your opinion, how relevant or important is this topic to you? From 1, you're just not thinking about it at all, or to 5, it's so important you're actually losing sleep on it. So that may be a bit of an exaggeration, but really from 1, not important, to 5, very important. Please give us your opinion on what you think, how relevant integration is for you. And then as you're doing that, our second question is getting a sense of what your experience is around collaboration or any kind of co-delivery of NTD campaigns with other health programs. So, and Allie says, if you have any problems seeing the poll, let us know. But in that poll, we have certain options that maybe you've collaborated with some components between different campaigns. The second option is that you've actually been involved where campaign interventions were either fully sort of integrated or co-delivered, or you have no experience, and that's perfectly okay. You'll get a lot from just participating. So please take a few minutes to answer the poll. I am going to go look for my charger so I don't lose this. And as I look for it, Allie, as the poll numbers keep coming in, I will have you just start reporting out on that in just a second.
All right, folks, maybe 30 more seconds or so here to respond to the polls. It looks like 80% of you have voted, which is a pretty good return in our recent experience. So thank you. All right, so I'm going to end the poll now, and we can take a look at the results and look at how we're distributed here as Chris gets her charger and remains connected for us. So let me share the results. Hopefully you all can see the polling results here. And I'm actually surprised to see the response to number 1 around the room. So the virtual Zoom room here. It seems like you all think that the topic of integrating campaigns, MDAs, what have you, is pretty important or relevant, with most of you, over 50% of you, saying, you know, it's at a 4 or 5, and no one is down in the kind of, you know, 1 or 2 not thinking about it. So hopefully that will feed into some good input in our breakout discussions that are upcoming, where we can really get some ideas generating around, you know, the different nuances involved in these integration considerations and the research required around those. Then moving here to the second polling question around your experience in collaborating with or co-delivering NTD campaigns or other health campaigns or programs. It seems like we're a mixed bag, which I think will also hopefully bring us into the breakout discussions with some nice diversity in our kind of backgrounds, inputs, viewpoints that we're bringing to these conversations. And Chris, I see you're back. I'm having to move around my windows, but I'll let you add any final points before I stop sharing the results and we move on.
Yeah, thank you. I caught my computer just as it was completely crashing. Didn't realize that my new setup here in the office didn't have the plug. Thanks again for your input. And I think what we'd like to do, we've got another poll later on. What we'd like to do now is introduce Dr. Eva Bazant. Eva is our Senior Associate Director for Implementation Research on our team. And she also is leading our new campaign integration working group, which is the first work group that our coalition has started given the interest in this topic. And so Eva joined our team in July, and she comes with over 20 years of experience as a program evaluator and mixed methods researcher in global health. So Eva, I will mute myself and turn it to you. Thank you very much.
Thank you. Just 1 second as I get to the right mode of the slides. Great, so thanks everyone for joining back after the break. And this is a short talk about our early thinking into a campaign integration learning and research agenda. And as Chris mentioned, I'm one of the staff members on the Health Campaign Effectiveness Program at the task force. And I've had the privilege the past few months of working with a campaign integration working group that we formed. So this reflects some of our thinking and discussions with the working group that has both country members and global health members. So this is a brief outline of what I'll cover in the next few minutes. And I'd like to briefly go back to some definitions. I know the word integration is used in many ways, and so it can sometimes be used when we're talking about taking interventions of a campaign that may be delivered then by the routine or regular primary healthcare system. It can also sometimes refer to intersectoral collaboration. In this talk, we're going to kind of keep a narrower definition of campaign to campaign integration, which we see in two ways, which was alluded to by, described by Chris earlier when this earlier session began, and also in the poll you just saw. So we're referring to full integration as co-delivery, where two or more interventions are given at the same point of service. And also there's collaboration in the earlier components. And partial integration is focused collaboration in the components of a campaign without that co-delivery. So this is again, part of our early thinking that came out of a literature view and stakeholder consultations that is described in a technical brief available on our website. So from that effort, we identified several evidence gaps. So this is where we'd really like some more evidence and information that may come from case studies or implementation or operations research. We'd like to understand more about the factors that explain the success or failure of integration, the metrics or measurement of that, the processes and the best practices that are used when interventions are switched from a mode of campaign delivery to integrated delivery, or a single campaign to integrated campaign delivery, the elements of campaigns that get integrated in the case of partial or full integration, as well as the stakeholders involved at each stage, as well as the choice of criteria in the decisions to integrate. And we, of course, like to keep our mind on the understanding the benefits, as well as the potential disadvantages and trade-offs of campaign integration. So we'd like to take a balanced view and take a look at all that. So earlier in October, we had our first annual Health Campaign Effectiveness Coalition meeting, and there was an integration track. And from our discussions with those participants, we decided that it was important to understand a little bit more about the stakeholders and the data. So our participants were asking us, we need to focus not only on the planning phase, but also on the pre-planning phase of integration, and that time where there's negotiation of the integration and what kind of commitment is being made and the coordination structures that are in place, and the importance of understanding the various needs of the stakeholders. And then for the data platforms was a point of discussion, and we looked at data sharing across programs where that may have happened or where it could happen for greater efficiency, as well as understanding integrated health information systems and high quality geospatial data. And I know that's been a subject of this conference as well. We did some early seeking of information from country campaign managers in August and September through a pilot survey, and it had largely open-ended questions. We did hear from 39 campaign managers from 25 countries across the 5 domains that we're looking at. So that's neglected tropical diseases, immunizations, polio, malaria, and vitamin A. And that this survey was done to understand some of the challenges of restarting and starting campaigns in the COVID-19 era, and to understand to what extent campaign integration is being considered. So a high-level summary of findings is that of these respondents, 82% said they were either considering campaign integration or planning it or actively engaged in it. And there were a variety of actors who were involved, from national government, program work groups, partners, donors, and they described a process for decision-making, which included assessing risks and benefits. There were a number of approaches that were described, including combining NTD campaigns that use albendazole, using the EPI immunization platform for deworming, leveraging the antenatal period to deliver additional interventions in the home. Respondents talked about considering integration within one domain, so within NTD, MDAs, different MDAs, as well as in the immunization and malaria space. They talked about integrating some of their campaigns that they had planned. And then there was quite a bit of discussion with the variable responses of integration across domains. So for example, deworming with vitamin A and measles or polio vaccination, for example, what we heard in the first part from Somalia, as well as other configurations you see here. So currently we find ourselves in a phase we're calling the opportunity assessment, where we are trying to gather more information on this. So our questions are sort of, what are the criteria or other factors that are used to identify the campaigns or geographic areas where integration may be feasible and beneficial? What are the circumstances in which integration is being considered, the opportunities? How are integrated campaigns being planned or budgeted? Do campaign managers have the information on the additional costs or the cost savings that may be incurred by integrated campaigns? What does good integration look like in terms of programmatic efficiency and some of those measures we'd want to see? What is the involvement of communities, or what could be the involvement of communities in community engagement as programs decide to carry out integrated campaigns, and some of the promising or best practices? And in implementation research going forward, we'd like to explore what are the barriers and enablers of campaign integration at different levels and again, in the COVID-19 context, and what kind of leads to integrated campaigns being considered, planned, initiated, or even stopped. And what are the stakeholders involved at each stage, as well as the financing and funding sources. And there's quite a bit of interest in understanding what campaign health workers think and perceive with integrated campaigns, as their satisfaction perhaps with the process, their engagement, their compensation, perhaps how they're paid, and also understanding the data flows, how the data flow goes to higher levels and does it come back down to district levels, for example. And of course, I think many of us would be interested in the outcomes and coverage, of course, an important measure. And is it equally paid attention to for each intervention being integrated? And what is sort of the data quality? What are the levels of acceptability among the population, as well as the health workers, as I mentioned? Looking at equity for all groups, whether populations that had been missed with prior interventions then are reached in an integrated campaign, looking at efficiency, cost effectiveness, and again, the opportunity costs or the trade-offs that might be part of integrated campaigns. And of course, the focus on health impact and potential for sustainability of the intervention delivery. So that's sort of our early thinking. And we've also started working on a criteria and decision toolkit for integrated campaigns. At our October coalition meeting, we did have a fruitful discussion with participants about what we're kind of brainstorming the criteria for campaign integration. So you see a lot of words on this slide, but we thought, of course, there's certain aspects of the interventions being combined that we need to keep in mind, as well as criteria at the local, national, and global level. So this is sort of an initial list we're working with. And we've kind of mocked up an initial tool whereby we would list all the main interventions. And of course, this doesn't include all the NTDs, so apologize about that. But if campaign managers were sitting down to think about campaign integration of 2 or more interventions, honing in on one of these cells would be, for example, a pair of interventions, for example, vitamin A and deworming. And then to use the criteria on the previous slide to articulate what might be the facilitators or barriers of planning that integration. So we're trying to combine this information. We really look forward to your inputs on this. So thank you again. And we look forward to a discussion and your thoughts and ideas on important questions to consider. So thank you.
Thank you, Eva. And so we've got just a minute or two before we go on our breakouts. And if you have any questions for Eva right now, please feel free to, I don't know if you can raise your hand in your participant or just put it in the chat or turn on your camera. I think we maybe just see you that way if you've got a question. As Eva mentioned, we are at the early stages of trying to pull together a lot of the best and promising practices and where the evidence is, and have identified a lot of evidence gaps around the, how we even define what we mean by integration. Sometimes it's more of a collaboration that we're really looking for and makes sense, and other times it could be actually co-delivery. So this whole sort of spectrum is an area that we'd love for your input in, and also to help us think, which was what we're going to talk about in the breakouts in a minute, help us think through some of what the important knowledge and evidence gaps are, and where we should, as a sort of a cross-campaign coalition, focus our energy for research and learning. So with that, we'd love to hear from you again. So we've got another poll for you lined up to help. We've thrown out some different advantages and disadvantages around integration, and would like to hear what your thoughts are on these. So Allie, you can put the poll up for us. So our first question again is, we've identified a list here of potential advantages to integration. So which of the following advantages, again, thinking about integration from everything sort of that collaboration to the full sort of co-delivery, do you feel are most compelling to decision makers? So if you could put in your top 1, 2, maybe 3 choices on this list of several different potential advantages. And if you're not sure, that's just fine. Put ahead, not sure. The second question is, of course, in addition to advantages, we'd like to know what your thoughts are on the following challenges or barriers to integration that you think are most important to address. So that's question 2 there. And again, we've listed a series of different options for you. Take a few minutes to read those. And again, if you're not sure, feel free. So we'll just take about a minute here. Please look at both of the advantages and challenges and give us your opinion. All right, I know we have about 30 people in this room, so we should be getting quite a bit of responses coming up in the next minute. Give you about 20 more seconds, I think, to give your best guess on the advantages and challenges to integration and collaboration between different campaign programs. Okay, I'm hearing from Pendra that for question 2, it will only take one answer and doesn't allow multiple selections. They're both supposed to allow you to select more than one, but thanks for that feedback. We'll see if that...
Yeah, the only way I can change it now is if we end the poll and redo it.
Okay. All right. Well, sorry about that. I guess you can only, at this point, it was meant to allow you to select up to 3, but I apologize for that. So now that's why the numbers look so small in that. Okay. Well, let's see what we have here. So in terms of the advantages to integration, I am seeing, at least from the view I have, that the one that pops out the highest that it was scored is that it reduces the burden on the same communities and community health workers. And indeed, that is a key advantage that we've heard as well. We'd love to explore in some of the questions and research and what does that really look like. Also seeing some advantages that have popped up around cost savings, and improved efficiency. So again, I think these are areas for advantages. Do we have the evidence on this? Is this sort of what we suspect are advantages, or do we really have the evidence to look at it? So keep that in mind when we start thinking about opportunities or evidence gaps or questions for our operational and implementation research agenda. Certainly there's several of you put information that you think about rapidly increases the coverage as well as allows in campaigns to access those hard to reach populations and identifying populations at risk. So when I turn to, again, with the understanding that it looks like you were only allowed to select one in terms of the challenges or barriers, the one that was selected the highest, so it looks like we have a tie in terms of biggest barrier challenge could be donor funding is not aligned, or and sharing of budgets between and across programs is not easy. And also there's the increased complexity around planning and training at multiple levels for integration. So indeed, those are really important barriers. We've heard those, I think, in our presentations earlier in the session beforehand. And again, I think our reason for hearing your opinion is where we think some of the emphasis should be placed on operational and implementation research and learning. But I'm also seeing that there's at times a lack of high political commitment, you've noted, and different target populations and sort of the challenge of getting those aligned around the disease frequency and seasonality. So thank you very much for your opinion. This helps us understand too where you're coming from as an audience, and certainly I think gives us some fuel for thought as we move into our breakout session. So I will just in a second here read the instructions for our breakout exercise. And let me see. Okay, so we're going to move into maybe just a tad over time, but about 35 minutes for our breakout, 35 to 45 minutes for our breakout session. We're going to randomly assign you into 3 groups, but all 3 groups are really good topics, so don't worry about that. The 3 topics that we have are first around collaborative planning between campaigns and implementation considerations around integration between NTDs and other campaigns. The second breakout is going to be talking about measuring the effectiveness of integrating NTDs with other campaigns. And the third breakout is around considerations for transitioning from an NTD sort of intervention from mass drug administration sort of single vertical campaign to a more integrated delivery within primary healthcare services. So we will have facilitators and note takers for each of these. And in each session, we've got about 3 questions that we'll be asking you, again, all aiming to help identify where we see are the key knowledge gaps and priority research and learning questions or topics that will contribute to the COR-NTD agenda, as well as to the health campaign effectiveness, implementation, and research learning agendas. So each of the groups will develop 1 slide with our reporter to come back afterwards and do a share out. So without further ado, I will stop sharing my screen. And I believe we will be put into breakout teams in just a second. Yeah, I couldn't find my unmute button at this time. I hope everyone had a really good discussion. We had a great discussion. And oh, to show me, I'm glad you found the right platform. Yeah, it's a little confusing so we are going to take a few minutes before we close and hear from the 3 groups. It looks like I figure since I was in group, I guess I was in group 2, and I have the floor, maybe I'll go ahead and start, and then we'll hear from the group around collaborative planning and implementation of integrated campaigns, and then the other group, the 3rd group, on sort of transitioning from a campaign to primary healthcare. So let's see if I can get myself organized on the share screen again. Okay. Why? Let's see. Okay. Are we seeing the slide? Very good. Thank you. All right. So we had a great group. Our topic was, how do we measure the effectiveness of integrating NTDs with other campaigns? And and so our questions that we addressed were, what metrics or measures should be used to measure? What are the most significant sort of measurement needs or knowledge gaps that we have when we think about evaluating or monitoring an integrated campaign and assessing the impact? And then do we have sort of like top 3 or 5 questions that we would put in an agenda? So apologies, I wrote this very quickly. Poor Ansley got kicked out. Our note taker got kicked out of the session, and so pulled this together on the fly, and so that's fine. But our group talked about, again, obviously, as good evaluators, we always need both outcome and sort of impact measures, as well as those around process. And so realizing, as we were talking, that of course it really depends on what is the package of integration. So we always have to look at like which diseases and sort of what contexts are we talking about? And that determines, of course, what those outcome and impact measures would be. And so that's sort of like our first step is on that package. We talked about really, again, and this sort of dovetails with our group, I know, around planning. A lot of this information about deciding, when and what you should integrate, having the data to make those decisions needs to be put up front. And so one of the key areas that we highlighted too is around cost effectiveness. That rose as a potential benefit. And when we did the poll, being able to share costs, but and make this essentially less costly, but we don't have the data. And so we definitely need data around costs of integration. How do we measure the cost effectiveness? And then ultimately for decision makers needs to show that we have lowered our mortality and morbidity levels. We also talked about then being able to pool, the sort of goes with it, being able to pool funding together. And so that's a piece of being able to do that cost is being able to share how it's disaggregated across different donors or partners. In terms of some process measures and questions, we had certainly a need to be able to measure the community's acceptance. Certainly when you combine different drugs or different interventions, what will they accept? Being able to have good communication messages around that really means we need to understand our community. So being able to assess their potential acceptance in the front end, as well as being able to measure whether or not afterwards that they were accepting of an integrated approach. The capacity of health workers, we had some discussion around, I'm sure this is from the implementation group, around the challenges of doing training. And so certainly we have questions around the capacity of health workers being able to measure that and ensure that the training package is meeting their needs. A big question that we had also sort of dovetails with, I'm sure, the third group is we need to be able to show how an integrated package can actually strengthen the health system and the health services, and how are we able to measure this? And so that was a key sort of evidence and knowledge gap that we should be doing research around. And then ultimately we said if we are going to have any of this outcome data, it can't just be piled. We had an example where they reported coverage level from an integrated campaign, and it was sort of grouped together. And so we need to be able to have this data disaggregated to the different stakeholders by disease or community. And also those data need to be included in any kind of local HMIS or as well as surveillance systems. So obviously a lot of work to do around building out, understanding what are the different measures and metrics that different stakeholders need, and also being able to put that in place. So let's see, I will go on to then group one. Allie, are you the reporter for that?
Yes, thank you, Chris. And thanks again to, well, everyone that was in our little breakout group. Sarah and Carol helped facilitate, and then we had 5 really great participants sharing your ideas with us, on video, audio, in the chat. So I appreciate the participation that we had as we spoke around collaborative planning and implementation considerations for integrating NTDs and other campaigns. And our conversation, I think, mirrored a lot of, Chris, what you said came out of group 2, and we spoke about a lot of higher level considerations. Oh, I think that we've updated the slides since you have that version there, Chris. We were doing some speedy updating while you were sharing your readout. But overall, the question that we addressed was, what have been the most significant planning, implementation, or operational issues to address for integrating NTDs with other campaigns. And then within those, trying to really hone in on the opportunities for, examining the knowledge gaps and opportunities for, further research or inquiry there. And once the slide comes back up, I can walk through the main takeaways. Again, we had a lot of ideas generated here. And thank you, the main takeaways that we had were really around prioritization and alignment. So you'll see the top short bulleted list here is what we tried to pull out from our discussion as the main priorities. And then numbers 1 through 9 below there are some more details around the ideas that were shared. But just focusing on these top 4 bullets, we realized that there are a host of stakeholders involved in planning and implementing campaigns and collaborative campaigns for sure. When you talk about, different donors, different divisions within the ministries of health or implementing partners on the ground, potentially different pharma and other international partners that all need to come together to execute a integrated campaign or approach. And that this is a challenge that needs to be addressed, kind of aligning stakeholders and doing a prioritization, and one that makes sense for the countries and the implementing partners, and kind of having this, country-led approach, which is mapped out as a significant shift or a prioritized shift in the 2030 NTD roadmap. And kind of piggybacking off that there's room to explore how we can align funding towards integration and the considerations and, potential approaches there. Again, to what the second group there, Chris, that you moderated, discussed around aligning or at least linking the results and outcomes between the different programs that may be being integrated together. That has to happen at the planning and implementation phase, in addition to the monitoring and evaluation phase. So there's room for research there. And finally, as we were speaking about all of these great ideas, the overarching kind of charge was that the research priorities and objectives that are set reflect the shifts that are laid out in the 2030 roadmap, which are largely the shift of a focus on integration, a focus on impact and more output indicators than as opposed to historically what has been set as process indicators. And then this country-led ownership, approach to sustainability. So that's where we landed in group number 1.
Thanks so much, Allie, and everyone in this group. This is a great conversation. We have about 5 minutes left, so I'm going to ask group 3 to share what your findings were from your group, and then we'll have about a minute or two. If you can keep it to a few minutes, we'll have about a minute for wrap up and some final thoughts. So Eva, is that you? You're on mute.
So I'll read our charge here, and then I know Leah has a nice slide where she was capturing our discussion. So our charge was to look at the considerations for transitioning MDA campaign interventions to delivery through the primary healthcare system. And if you can unshare, I don't know if Leah can then share what captured our discussion. But we
in that same slide deck.
Oh, it's in the same slide, but I can't see the speaker notes, which is, or did you put it all here? Okay, great. Thank you. So yeah, so I guess I'll just read what's out here. Similar to the first group, Chris, there was quite a bit of discussion about cost effectiveness of integrating with the primary healthcare system and what is sort of the value for money, really need to get more information about that. And there was, it was articulated that the transition depends on the goals of the program. And for example, some diseases are reaching elimination. So we need to understand what are their elimination targets and whether they've been met and their post-elimination strategies. Also, I'll come back to that last point. We talked a little bit about sort of incentives for community health workers, the idea of community fatigue and distrust. We talked about the importance of leadership at the Ministry of Health and other agencies, how that affects this, as well as policy. And at the end, we started talking about sort of the idea of integration of any kind, kind of evokes feelings and sometimes of a sense of loss of, and it could be at different levels, whether it's a loss of incentives at the health worker level or at the program level, that maybe there would be a reduction in resources, which translates into power and control. So we just need to be mindful of those sensitivities as we, and really include the different stakeholders that are engaged to say, hey, let's look at the, disease burden and our goals and whether we're meeting them or not. We also had an interesting discussion that some communities, very remote communities, even in the Amazon basin, like the MDA or the campaign is primary health care. Like they don't receive primary health care other than maybe a twice-a-year integrated campaign. So how is the MDA viewed? Is it viewed as part of the primary healthcare system or not? So this is sort of like encapsulates our discussion, and we need to, of course, rearrange this, but thank you.
Thanks, Eva. Yeah, I just got a message from Leah that I guess she was revising slides as once they go on the slide share, they're locked. So it sounds like there was a more recent version, but we will be sharing this with you. We'll pull it together and be sharing it with everybody. Also, as part of the report out is for the COR-NTD report out, where each group will be contributing to the COR-NTD research agenda, as well as our next step is to be pulling together our implementation and research and learning agenda for the Health Campaign Effectiveness Program. And that is something that we're working on right now, and we will be appreciative of any of your additional feedback or interest in collaborating with us as we move forward in the next few months with this. And stay tuned as well, because I think I mentioned to our group that we do have a call for proposals for case studies out right now on collaborative planning for integrated campaigns. And in January and February, keep an eye on our website or get in touch with us. We'll have additional RFPs that we'll be supporting around implementation and operational research. And so really appreciate all your contribution and great conversation. Look forward to collaborating with all of you as part of the Health Campaign Effectiveness Coalition. And thank you again for all your great work and interest in joining us today. All right. Bye-bye now.
Thank you. Bye.